Hello, this course focuses on the clinical behavior of voluntary closing auto-locking technology, or VCAL. Because VCAL is a new functional category, this demonstration uses the ProHensor VCAL by Marins Inc. as the example device. The purpose is to show prosthetists how sustained hold, user-actuated release, selectable modes, and serviceable modular components may be observed, tested, and documented in clinical practice.
Hello, my name is Darryl and I am the CTO of Marins, where we have developed the ProHensor. I'm also a 35-year amputee. Today we would like to discuss first about hold and control with the ProHensor, and I basically want to discuss the three modes. Mode 1, which is the switch in this most forward position, allows the device to open to this a little more than 3-inch opening. It also locks in this mode as well. When it locks, you no longer need to apply any pressure or any force on your cable. And in addition to that, it closes and locks anywhere along the open and close path. With one more pull of the cable, the fingers open back up, reset, and are ready to lock on the next close cycle. This large opening is really designed more for larger objects, like a can of soda, a bottle of water, or in this case in the lab, holding a can of blast or silicone lubricant. And the nice part is I don't have to continue applying force on the cable to continue holding this object, especially within the working envelope. And then I can decide when I want to release it. For mode 2, we close the device. We can switch it into mode 2 and then open the device. Mode 2 is a non-locking mode, or just a voluntary closing mode. It returns on its own. And that's really designed for, like moving objects around that you don't necessarily want to lock onto, but you want to move. Like, that's a hard thing to grab. And so you only need one pull in this case to grasp an object, and then you can just let it go when you're ready to do that. And then mode 3, which is the switch in the closest position to the wrist. That is also a smaller opening. It's about 1.25 inches, but it's a locking mode. So just like with the larger mode, this locks anywhere along the open and close path. Now I can pick up an object like this and work very well within the working envelope. I can then give it one more pull to release the object. It's best, I think, sort of displayed with a piece of foam. You can see that I'm just applying just a little bit of force. There's no continued tension on the cable. And then I give it one more pull and release it. And what I'm going to do is I'm actually going to take the cable off so that you can see the action a little bit more closely. This is closed, it's locked, and then one more press on the cable arm and it unlocks and resets, and it's ready for closing again. If I want to stop anywhere along its path, it will stay locked there, and then a reset and unlock and back. Okay, now we're going to talk about the actual functionality of the ProHensor. The directions for use can be found on our website. That will cover all of these details, but we're going to cover them right here briefly. First of all, I'm using a standard commercially available wrist. It has multiple degrees of rotation, and it locks into position. It takes the 1/2-20 standard thread, at least in the United States. And so now we're going to talk about, we talked about the modes, but we're going to talk about the functionality. So when the device comes open, it resets and is ready to lock. When I pull the cable, the system is in a locking process. When I stop pulling on the cable, the device stays closed and locked on the object. The only way to reset it is to pull one more time on the cable arm. The device needs to open completely to reset, and now it is ready for another locking cycle. So once again, I'll use the ball to demonstrate. It has been reset. It is ready to close and lock. Once I've released pressure on the cable, the device will stay locked in that position. To unlock it, I need to apply another momentary force to the cable, which I just did. You hear it unlock. The fingers will completely open. You hear it reset one more time, and now it is ready to close and lock again. So one lock per close cycle, and once it's unlocked, it needs to reset, and now it is ready and able to lock again. So the last thing I wanted to mention is that the device can be closed at rest. So for purposes of putting the device in my pocket, or very often pulling a shirt with a sleeve over the device. If it's open, it tends to get caught along the way, but when it's closed, it's a little bit more streamlined, and it's much easier to pull a shirt on or a jacket or anything like that. So so for user friendliness, leaving the device closed allows you to function in the world until you're ready to grasp, and then all you have to do is just unlock it. It opens up, and now you're ready to perform that close and open cycle as necessary for objects. Okay, so I wanted to do a demonstration using something a little different than the foam, something that has a lot more compressive strength. If anybody has a dog, they know that these Kong balls are pretty tough, really hard to compress. And so I wanted to just show that when I compress that in my fingers, I definitely can feel the need to provide a lot more force. And now, once I have a hold of this object, the ball in this case, I no longer have to apply continuous force on my cable. I can do anything up and over my head. I can go behind my back, which is really nice, which would be very difficult with any other device. And I can work specifically within this space, which is typically very difficult for amputees to work in when they need to hold an object. And so now I can let go of that if I want to give it more, which I'm applying quite a bit of force on that ball. As you can see, it's somewhat compressed. And now I can release and let that ball go. So once again, I can function very easily within the working envelope. I can reach to the floor. I can reach over my head, and I still have full control over this object. We talked about hold and control. Now we're going to talk about the benefits of the hold specifically in terms of cognitive load. So I'm going to use the ball again really quickly and just once again show you that I have a firm grasp on this ball without having to continuously apply force on my cable. So now imagine that I need to do something where that becomes really important, like for instance, a nail set, and I want to hit that with a hammer. Now I have it in my grasp. I don't need to continue imagining how much force I need to apply to hold on to this object. I now only need to know where in space I need to have it so that I can hit it with a hammer, instead of needing to know where I need to have it and also applying force to maintain grip on that object. So this frees up my mind to allow me to work on a specific task without also imagining how much force am I applying to my grasp for that object. You can lock the device and you can push your pockets in when they stick out on you sometimes. Now we are going to perform the weighted box lift to chest. This is a test that's typically done in a clinical setting to evaluate device safety. And the way that it works is we're going to take a weight, in this case 15 pounds, and I'm going to place it in the box. And then I'm going to grab the box, I'm going to lock onto the box, and I'm going to lift it to my chest, which is well within the working envelope. And so I won't be applying any extra force on the cable once it's locked. So here we go. So now I'm in the working envelope. I'm not applying any cable tension because I'm outside of the zone that I can do that. I'm going to put it down, unlock, and then I'm going to do it again. Same thing in the working envelope. And we'll do it one more time just to show you one last time in the working envelope. And now we're going to put it down. Now we're going to do one more clinical test, and it is referred to as the overhead lift. And it is also a test to determine safety. In this case, I'm just going to add 3 pounds to the box because it's easier if it has a little weight. And I'm just going to put it in the box. I'm going to open ProHensor and I'm going to lock onto one of the sides of the box. And I'm going to lift it up above my head, unlock, and off I go. So now I'm going to demonstrate why the ProHensor's locking mechanism is of high value, especially in working out at the gym. So once again, this is a 15-pound weight. I can lock on that 15-pound weight. And although I don't have a lot of strength on my residual, that's pretty good. So now I can put it down, I can release it, and off I go. But that's 15-pound weight.
VCAL does not replace voluntary closing control. Darryl demonstrates grasp force modulation, body-powered feedback, cradling, proprioception, and deliberate user-actuated release.
Capability. The term is called cradling, and when we talk about cradling, we're talking about having the fingers closed, but not all the way, enough to have 2 points of contact on an object, whether it be a round can of lubricant in this case, where you want to be able to push it, but you don't want to have a single point pushing it. Or for me, riding a bicycle, and I like to just have 2 points of contact on a handlebar. And because the device locks closed, the fingers aren't going to open unless I ask them to. So I can apply force on the handlebars and the fingers won't ride by the handlebars. They will sit basically on them because it's 2 points of contact. So that is one of the really nice aspects about locking, is that I can choose to have the fingers closed wherever I want, and they'll just stay there until I'm ready to open them again. Capability. I wanted to discuss one more aspect of the ProHensor and its locking capability, is that when the device is reset and you're ready to lock on an object, as long as you don't release cable tension on the object that you're grasping, you have the ability to increase the amount of force on the object. So for instance, if I'm taking a look at this and I say, you know, this may not be enough force to hold onto this foam with enough force here between the fingers to keep it from slipping out. So as long as I have not released cable tension, I can continue to compress until I'm absolutely happy. Once I'm happy, if I release cable tension, you'll hear the click. Now that click says I am locked. I can no longer apply any more force, because if I do, the next force I apply is an unlock. So in this case, it just allows me a little bit more control over objects as long as I'm continuously applying force on the cable until I am happy with my level of grasp. And it's just one more aspect of a device like the ProHensor, which has a locking capability that you kind of can work with a little bit more. It just gives you more control over the objects that you're grasping. Now that we have talked about control of the ProHensor VCAL when grasping, we can now talk about controlled release when unlocking. You can audibly hear the click when there is a release moment, and that's the reset. Now you can kind of hear it, and we'll do it again without me speaking over it. So now once you feel the release through the cable, because it is a feeling, you can now gradually release the object in grasp with more control versus just this all of a sudden drop, if you will. So controlled grip, unlock, controlled release. So now I'm going to show you exactly what we're talking about specifically with proprioception and the ability to understand how much force you're applying on your cable and harness system for grasping an object. So in this case, I have it set to mode 1, the widest setting, and I'm going to just close. I can feel just a little bit of tension on the cable. This doesn't really provide a lot of feedback, but you can definitely feel it. And I have now released cable tension, and now I have this foam in grasp, and you can kind of see that about how much compression I have in this case. So now I'm going to unlock and open back up, and now we're going to go a little bit more, and I can kind of feel that just a little bit more feedback, a little bit more pressure on the foam. I'm going to open that, and now we're going to squeeze it all the way, and you can absolutely feel how much pressure you're applying on the cable system. And once again, this foam is so tight in here, it would never come out. There's no way to get this foam out without tearing it. You would absolutely have to rip it to get it out. And now I can release, and the foam is back to where it was.
The final technical demonstrations shift from user function to clinic workflow. Darryl shows how serviceable modular components may support maintenance, reduce downtime, and help keep the device in functional use.
Okay, so now we are going to talk about the ProHensor VCAL. It is a durable device, but it is also modular. It is in-field and in-clinic serviceable, and that is referencing both the fingers and the lock core cartridge. I'm going to now demonstrate how we swap out old fingers for new fingers. In this case, the ProHensor's modular fingers can be replaced either in the field or in a clinic setting. This is how a new set of fingers comes. You get a left and a right, or a right and a left, depending on how you look at it. So the supplied wrench, we're just going to remove this nut. You will need a small screwdriver to pry the finger out of the socket, because it does get wedged in there. And this is a good time to tell you that the ProHensor can be used either on the left side or the right side. It's non-handed, however, the fingers clearly would then need to be rotated. So I'm going to demonstrate how that might look. So because they're indexed, you can place the fingers 180 degrees from themselves. Obviously this is upside down for me, but that's what it would look like. It's kind of unique in that way. That's kind of cool. So that's essentially how fast you can swap out an old set of fingers for a new set of fingers when they become used or damaged. We are now going to demonstrate the lock core replacement process. It takes about 75 seconds, and I'm going to go through that demonstration right now. So to start, we're going to have the ProHensor mode in mode 1. We're going to open the device all the way completely open. We're going to take the supplied Allen key. We're going to remove the screw that is on the same side as the mode switch, because for a right-hander, the mode switch will be on the bottom, so you'll have to rotate the device. Going to take the cap off. Going to close the device, and in the device there are two holes that need to line up. You're going to take the Allen key that we used to remove the screw, and we're going to place it right in that hole. We're going to take the tab, it's right here, the removal tab, and we're going to bring it more or less in line with the fingers. Going to take the removal tool, hook underneath that tab, and also down on this side of the friction bar, and then we're going to pull the cartridge out. Now, if this were a brand new cartridge, we would just be replacing it, just like we would, like I'm doing currently. Going to get the tabs lined up, and it's just going to slide in all the way down. You're going to put pressure on the cable arm to remove the Allen key. The device is just going to open up to wherever it does. That part doesn't really matter. And now with the cap, we're going to catch this metal part right here onto this pin. And that's more easily done just by finding that spot, rotating, and then finding all of the tabs that line up. We're going to put the screw back in. Tighten that down, and off you go.
In summary, VCAL provides voluntary closing control, adds sustained hold without continuous cable tension, and supports clinical level serviceability, hold, control, and modularity. To receive credit, complete the quiz using the instructions provided. Thank you for taking the time to review VCAL technology and for applying it through practical, observable clinical tests.
Close and lock,